When it comes to staying healthy, we often focus on physical fitness, diet, or just getting through the day, but the truth is, there are certain signs and symptoms that can point to deeper health concerns. So, let's dive into some of the most common yet overlooked symptoms men need to pay attention to. 1. Persistent fatigue. One of the most common yet concerning symptoms men often dismiss is persistent fatigue. It's natural to feel tired after a long day or a hectic week, but when exhaustion becomes a constant companion, it could signal something more serious. Persistent fatigue can be a sign of various health issues, including sleep apnea, depression, anemia, or even heart disease. If you're sleeping enough, but still feeling drained, it's essential to consult a healthcare provider. Fatigue can also be linked to high stress levels, nutritional deficiencies, or thyroid problems. If you find yourself exhausted even after taking rest, you should not ignore this warning sign. A simple blood test or a full health checkup could reveal if there are underlying issues. 2. Shortness of breath or chest pain. Anytime you experience shortness of breath or chest pain, it's something you should never ignore. Chest pain can range from mild discomfort to a sharp pain and might indicate something as serious as a heart attack. Shortness of breath can occur with conditions like asthma, pneumonia, or even anxiety. But it's important to note that it could also be a sign of heart disease, especially if combined with chest pain or discomfort. If you feel pressure or tightness in your chest, or if your breath becomes labored, it's best to seek immediate medical attention. These are symptoms that can't be brushed off, and acting fast could mean the difference between life and death. 3. Changes in urination. Men, as they age, may experience changes in their urinary habits. Whether it's frequent trips to the bathroom, difficulty starting or stopping urine flow, or a sudden increase in urgency, these changes could indicate a variety of health issues. For instance, it could be a sign of benign prostatic hyperplasia, BPH, a non-cancerous enlargement of the prostate, or a urinary tract infection, UTI. In more severe cases, it could signal prostate cancer. If you notice a drastic change in your urination patterns, such as blood in the urine, or if the symptoms persist for more than a few days, you should see a doctor right away for evaluation and diagnosis. 4. Unexplained weight loss. Losing weight without trying is another red flag that should not be ignored. While weight loss might seem like a good thing for some, unexplained weight loss could be a sign of serious health conditions. It might be linked to thyroid problems, diabetes, gastrointestinal disorders, or even certain types of cancer. 5. Difficulty getting or maintaining an erection. Erectile dysfunction, ED, is something that many men experience, but it's often a topic they avoid discussing. The occasional issue with getting or maintaining an erection may not be concerning, but if it becomes a regular occurrence, it could indicate underlying health problems, including heart disease, diabetes, or low testosterone. Erectile dysfunction is often a sign that something more significant is happening within your body. It could be a result of poor blood flow, hormonal imbalances, or even psychological issues like stress and anxiety. 6. Sudden vision changes. Sudden vision problems, like blurry vision or difficulty seeing clearly, can be caused by a variety of factors. For example, it could be a sign of diabetes or high blood pressure. Both conditions can damage the blood vessels in the eyes, leading to vision impairment. In some cases, sudden vision changes can also signal a stroke, especially if accompanied by other symptoms like weakness or slurred speech. 7. Persistent headaches or migraines. While occasional headaches are common, persistent or unusually severe headaches can be a cause for concern. If you experience headaches that seem to come out of nowhere, or if they become more frequent or intense, it's worth investigating. Chronic headaches can be a symptom of high blood pressure, a brain tumor, or even a stroke, especially if accompanied by nausea, dizziness, or changes in vision. 8. Swelling in the legs or feet. Swelling in the legs or feet can indicate a variety of issues, from minor injuries to serious health conditions like heart failure or kidney disease. If you notice persistent swelling or a sudden increase in swelling, especially if it's painful or accompanied by shortness of breath, you need to seek medical advice right away. 9. Skin changes or new moles. Changes in your skin, such as the appearance of new moles or changes to existing ones, should never be ignored.